Typhoid fever is a bacterial infection transmitted by contaminated water, milk, shellfish or other foods. It is caused by a kind of organism called Salmonella. It usually thrives in the human excreta or waste matter. It is common during the rainy season and it is distributed into the foods we eat which contaminated with Salmonella. The characteristics of a person infected with Salmonella are lesions consist of ulcers which form in the intestine. In the first week a person is infected with Salmonella, the following signs can be seen like vomiting, diarrhea, headache, cough, weakness of the body, long continued fever accompanied by chills, and on the second week, appearance of rose-colored spot, rash, dehydration, weight loss, enlarged spleen, slow pulse, and decreased number of white blood cells. The organism usually enters the body through the mouth. It attacks the walls and mucous membrane of the gastrointestinal tract, leading to the spread of the disease, which often localizes in the intestinal walls, producing ulcerations of the small intestines. Diagnosis of the disease may include the following: 1. White blood cell count. 2. Blood analysis. 3. Stool and urine analysis. The treatment and management of typhoid fever is usually supportive. For instance, if fever is present, the patient is encouraged to drink plenty of water and fruit juices. Sponge bath is also recommended to lower body temperatures. A food high in calorie is given to the patient to build up resistance. If there is severe ulceration, signs of intestinal perforation and hemorrhage or bleeding like apprehension, sweating, pallor, weak rapid pulse, sharp abdominal pain, rigid abdomen, and presence of bloody stools should be dealt with immediately. Blood transfusions and intravenous fluids may be ordered to prevent dehydration and shock from bleeding and peritonitis. Surgical consultation should be requested immediately for the above-mentioned complications. Preventive measures like mass administration of anti-typhoid fever vaccine may be given. Routine stool culture and analysis after recovery must be done to determine whether the patient has fully recovered from the diseases or not. Patients and carriers may be given ampicillin, chloramphenicol or cotrimoxazole to retard and prevent the development of bacteria and to totally remove the disease from the body. Recurrence is high for insufficient antibiotic treatment of typhoid fever. It is also very important that the treatment be followed strictly. Never try to self-medicate with antibiotics since it might be dangerous to patients, and the patient may develop a resistance to antibiotics. Follow what the doctor says. Supervise diligently the serving of food, especially when preparing raw foods. Always wash your hands with soap and water before and after serving raw foods. Maintain environmental hygiene and cleanliness for patients' protection. Always use purified water supply, never use tap water. Employ a sanitary way of disposing waste matter. Pasteurize and refrigerate milk and dairy products. And carefully cook the food. Ensure that cleanliness was done in preparing the foods. Last but not the least, frequently wash your hands. Washing your hands helps in preventing the spread of diseases. Thank you for watching my videos. Subscribe, like and share.